Presiding Officer, tomorrow is the 11th of November, and as we head towards Remembrance Sunday, we remember all those that have made the ultimate sacrifice in defence of our country, and we also thank all those that have served and continue to serve our armed forces and pledge to support them, their families and their communities. We must never forget. Presiding Officer, for the first time in their history, the Royal College of Nursing have voted for strike action. This strike isn't just about pay. Nurses have been underpaid, undervalued and under-resourced since long before the pandemic. This is the words of Julie Lambert, the chair of RCN Scotland. The Scottish Government needs to face up to the reality that their failure to focus on workforce planning and to properly value those in health and social care over the last decade is the root cause of the staffing crisis we face. The result of our strike ballot is a wake-up call that must not be ignored. Deputy First Minister, do you agree with Julie Lambert and thousands of nurses across the country?
Deputy First Minister.
First of all, President, let me associate myself again with the remarks of Mr Sarwar in relation to Remembrance Day. In relation to the situation in the National Health Service and the comments recounted from the Royal College of Nursing, let me first of all make it absolutely clear that the Government remains committed and willing to engage in dialogue and negotiation with the Royal College of Nursing and with the other affected and interested trade unions, as we have been doing for some considerable time, and notwithstanding the decisions that have been made by the members of the RCN, we will continue that dialogue, and I commit the Government to that today. In relation to workforce planning, well, we find ourselves in a position today where we have record staffing levels in the National Health Service. Those staffing levels have been the product of sustained investment by this Government, despite the climate of austerity in which we have been operating for some considerable time. The Government will continue to sustain that investment and to ensure that we have adequate levels of staffing. But the limitations on what the Government can do are firmly restricted by the financial context in which we are operating, the limitations of the pressures on the public finances. But I assure Mr Sarwar and Parliament the Government will do everything in our power to properly support the health service workforce and to ensure we have adequate numbers of staff within our National Health Service.
Anna Sarwar.
Let me start on a point of agreement. I agree we're in the midst of an economic crisis, an inflation crisis that has been made by a rotten Tory government at Westminster, and they should pay the price for that, and they will pay the price for that come the next general election. But the Deputy First Minister missed the point of what Julie Lambert was saying: a decade of failure, a decade of not supporting, long before the last 7 weeks of this economic crisis, and even before the pandemic and even before Brexit. But still, this Government gives the same old platitude about more numbers when we have record vacancies in the NHS under this Government's watch. And this action is as much for patients as it is for nurses. Nurses have been warning for years that staff shortages risk patient safety. And let's look at just one health board, Greater Glasgow and Clyde. In just 1 year, they reported 216 investigations into significant adverse events. And these are events that, the quote, could have caused or did result in harm to people or groups of people. Among the top reasons for why they happened are workload, staffing levels and delays in referral and treatment. The same report reveals that 6 people died due to these unintended incidents. Deputy First Minister, nurses are saying that a lack of resources is putting patients at risk. Lives are being lost and health boards are reporting the consequences. Yet this Government's failure to workforce plan means 6,000 nursing and midwifery vacancies. Why have you let it come to this?
Deputy First Minister.
Mr Sarwar's comments are not borne out by the evidence that I have marshalled in my answers today. Because I'm addressing the questions from Mr Sarwar, and Mr Sarwar has raised with me the issues about workforce planning. We find ourselves today with record levels of staffing in our National Health Service. If that is not a product of workforce planning which has been designed to boost recruitment levels, we've seen over the last 10 years an increase in nursing and student midwifery admissions over the course of that 10-year period as a consequence of the investment the Government has made. We have also, we're in a situation where we have an increase in the number of consultants that are operating within the National Health Service. In Scotland, we have 8.3 qualified nurses and midwives per 1,000 population, compared to 6 in England. All of that comparative data shows Scotland to be in a better and a stronger position. Now, what I don't think helps the situation is the comments made at the weekend by the leader of the United Kingdom Labour Party, who said, "I think we're recruiting too many people from overseas into, for example, the health service." I listened to those comments with incredulity, because what is hampering us in the National Health Service is the Brexit that was inflicted on us by the Conservatives, ending free movement of individuals, which has lost members of staff from our National Health Service. We need to reverse that. We need to have an approach that is open to migration so we can boost the recruitment into our National Health Service. And the comments from Keir Starmer are a disastrous signal to give to hard-working members of staff.
Anna Sarwar.
Presiding Officer, let me address that final point. I have led a cross-party campaign in this Parliament against racial and religious prejudice, so no one should miscategorise my position or the position of my party. So let me be. People might want to heckle, but they should listen.
Thank you. We will hear Mr. Sarwar.
Let me be clear. Migrants play an invaluable part in our NHS, and they always have done, and they always would do. And I would also say people that come and work in our NHS are not migrants. They're equal Scots, just like the rest of us. But that should not stop us having a credible workforce plan that means we train more doctors and nurses here. Now, the First Minister has rightly been calling in the last few days for more action on loss and damage on climate change. So we should not pretend that taking nurses and doctors from developing countries does not cause loss and damage to healthcare systems in those countries. So let's not create a climate of fear. Let's not change and play on that rhetoric that's beneath the Deputy First Minister, and let's actually talk about what's happening here right now in the SNP's watch. And I also listened to the answer the Deputy First Minister gave. His head is frankly in the sand. If it's so good, if it's so rosy, why are they striking for the strike action for the first time in their history? Nurses have been crying out for years about the problems long before the pandemic. And let's not forget, these were the staff who kept going even when their lives were at risk from a deadly virus, but they're now being forced into action to try and save their patients' lives. Week after week, tragic stories come to this Parliament, and week after week we get the same old excuses. This Health Secretary and this government are clearly out of their depth. After 15 years in government, 750,000 Scots on an NHS waiting list, the worst ever waits at A&E, and now the Royal College of Nursing going on strike for the first time in their history. Does the Deputy First Minister accept that our NHS has not faced a crisis like this in its history, that it's the worst it's ever been, and it's all happening on the SNP's watch?
Deputy First Minister.
First of all, I think I touched a very raw nerve with my comments about Keir Starmer, because anyone looking at my track record of all my public service will find that I have always been on the side of openness and about welcoming people from other countries into our society. And the point I'm making to Anna Sarwar is that our ability to recruit staff, our ability to provide the necessary means by which people can work in our National Health Service have been totally undermined by Brexit and the Conservative government. And Keir Starmer, by his comments at the weekend and by his hostility to addressing any issues about migration, is simply taking the same line as the Tories, and that is an absolute disgrace. And let me say that any international recruitment undertaken by the Scottish Government is done through an ethical route, and we do not actively recruit from any of the World Health Organisation's red list countries in relation to recruitment of staff. Now, lastly, I have acknowledged this afternoon, as my colleagues have done on other occasions, there are huge pressures in the National Health Service. They are because we have had a pandemic. It is because we are recovering from that pandemic and we are experiencing enormous strain in the process of so doing. So in that sense, I accept the points that Mr Sarwar is raising about the seriousness of the situation that we are facing. But let me tell Mr Sarwar this. The Scottish Government is absolutely focused on giving the necessary leadership and resourcing to addressing those circumstances, and we will continue to do so. And by the reactions and the support of people in Scotland over successive elections, the people of Scotland are supportive of the work that we undertake.